Alright, thanks for watching this video. So this is my midterm project, and I picked this topic, approaching anatomy and physiology, because I want my fellow peer physical therapists to realize that when looking at body structures and understanding function, origin, insertion, that it all doesn't necessarily have to be memorized. Of course, there are some things, but my purpose is if you can understand function and what the muscle does, then the origin and then the insertion should make sense. And at the end of the video, we'll talk about some pathologies. So we're going to focus on the shoulder complex in this video. So like I said, my name's Tom Mossbarger, and I'm a Doctor of Physical Therapy student here at Georgia State. So here we go. So we're going to look at the shoulder complex here. So just some basic anatomy. So this bone right here is our humerus. It's articulating with the scapula, this flat bone right here. The clavicle articulates here with the scapula and here at the manubrium, which is a portion of the sternum. So let's get into it. So what we're looking right now is an interior view of the shoulder. These are the ribs here, by the way. We're not going to really be discussing those much, but just for a reference point. So interior view, we're looking at the front of the body. So let's get some landmarks here. So this is going to be our proximal humerus. Distal humerus would be down near, well, at the articulation between the radius and ulna humerus. Then we've got this joint right here is called the glenohumeral joint. It's an articulation because where two bones come together is what we call an articulation. So the humerus and the scapula form the glenoid. Over here we've got the sternoclavicular joint. Hence the sternum and the clavicle articulate together. We've got the acromioclavicular joint. It's called that because this bony prominence on the scapula is called the acromion, and so it's articulating with the clavicle. These are going to be important for the humerus. This is the greater tubercle right here, just this upper portion. It's a greater prominence than what we have over here, the lesser tubercle. It's kind of hard to 3D draw it, but they're basically bumps that come off the bone, and this one's just larger than the other one. And actually what runs between them is called an intertubercular groove or sulcus, or sometimes called the bicipital groove because that's where the bicep actually runs between. And then last marking that I want to discuss real quick is the coracoid process, and we're going to have some muscles that actually come off of that bony prominence and attach elsewhere. So let's kind of get into some of our muscles then. So let's look at the first one. This is a rotator cuff muscle called the subscapularis. It sits in the subscapularis fossa, and it inserts onto the lesser tubercle of the humerus. It does a few things. If you look, it inserts onto the anterior portion of the humerus. So it's going to medially rotate it. Should make sense because it's grabbing the front of it. So or we call that internal rotation. So that's its main job. And also, actually its main job really is a stabilizer. So it's a big stabilizer of the joint. It's the biggest rotator cuff muscle there. And there's others, but we won't see them until we're on the posterior side of the shoulder complex. And then we have the coracobrachialis, which is going to come off of the coracoid process. So let's put that in here. And it's going to insert on the medial side of just the middle arm. It doesn't have a particular groove or bony prominence that it inserts. It's just more left on the middle shaft of the humerus. Let's see if we can get that in place there. That's good enough. Okay. Next, we've got the biceps brachii. Bi meaning two, brachii meaning arm. So there's two parts to this muscle. We've got the long head, we've got the short head. Let's start off with the long head. The long head is actually going to be, hence longer. It runs all the way up between the greater tubercle and the lesser tubercle and inserts onto the greater tubercle of the scapula up here. So it goes up here up on the scapula, just over the labrum, which we'll talk about later. So that's the long head. The short head is actually going to come off the coracoid process, just the way the coracobrachialis did, and both the bicep muscles are actually going to articulate, or I'm sorry, not articulate, attach on the radial tuberosity. There's actually another muscle we can't see because we're zoomed in a little too much called the brachialis, and it inserts onto the ulna, or the coronoid process down there. And the reason is that it causes the elbow to flex, and it also causes some shoulder flexion too. So the brachialis flexes the ulna, and the biceps brachii, long and short head, they flex the radius. So it's important to think about it that way. Another muscle actually comes off of the coracoid process, and it's called so we're starting to build some layers here. So you can start to see that some muscles are more superficial and some are more deep. Like this subscapularis is very deep. It gets covered up by a lot of these other muscles. So the pectoralis minor, which is what this one is more superficial to our deep muscle, the subscapularis. And it starts at the coracoid process and inserts onto ribs 3 through 5. Next, this is called the serratus anterior. Now, if you know the word serrated, it's kind of like a knife. It's sharp, and that's exactly what the serratus anterior looks like. Now, this is really a posterior muscle, and this is actually going to be deeper to these, so I shouldn't really put it on top, but I'm just going to. But it actually originates on the medial border of the scapula, all the way in the back, and it's actually going to cause our scapula to protract. So the scapula is going to kind of come around, move along the ribs towards us in an interior direction. But it's an important muscle in our shoulder complex that we're going to discuss in a little bit. So that's the serratus anterior. I'm going to go ahead and get rid of that for now. And lastly, well, nope, 2 more. We've got a big guy right here, pectoralis major. So he is a very superficial muscle, and it's going to cover all this. And it actually inserts over here on the intertubercular groove where the bicep runs. And this is a special muscle also. It forms a spindle, and it's very strong. So these kind of like twist and overlap on each other, kind of the way a spindle does. So it actually has 3 origins. And what else I want to mention is where a muscle originates has a greater base. So where it originates, it copies more space. So it originates on the clavicle, the sternum, and costal cartilage of the ribs. And see how it has an itty-bitty insertion point along the bicipital groove, or we call it the intertubercular groove. All right, and last, very superficial muscle again, is the deltoid. And the deltoid has actually 3 parts. We're looking at the anterior deltoid right here in front of us. There's a lateral deltoid, which we could see if we looked at the side, and there's also a posterior deltoid as well. And because of its name, there's a prominence, a bony prominence on the humerus called the deltoid tuberosity, and that's where it inserts. The deltoid does a few different things. It causes shoulder flexion from the anterior portion. It causes extension on the posterior portion, and we're talking about the humerus moving. And it also causes shoulder abduction on the lateral portion. So it's a pretty important muscle in the shoulder. So you see how we kind of built the shoulder complex from deep to superficial, and it's helpful to think of it that way. Now what we're going to do is we're going to look at the shoulder complex from the posterior view. So I'm going to slide this out of the way here, and let's take a look at it from another perspective. So here we go. So this is the posterior aspect of the shoulder complex. So we're still looking at the scapula right here. A couple important markings. This is the spine of the scapula. This is coming at us. I started to try to draw a shadow. The clavicle's running over here. I drew part of it. Clavicle is coming over here to the acromion like we saw in the front. And then here, of course, is our humerus, being the greater tubercle and the lesser tubercle. So we're looking at the posterior view. All right, so here we go. A couple important bony markings. The supraspinatus fossa, oops, up here I mean, it's above, hence supra, and that's where the supraspinatus muscle is going to come from. So it's a depression. Anytime we hear fossa, it's a depression rather than a bony prominence sticking out. Then we've got the infraspinatus fossa, which is below the medial border of the scapula, medial towards the midline, our vertebral column. And then I said this was the spine of our scapula. And a couple things to mention. These are our vertebrae down here. This is actually thoracic vertebrae, T2. We'll have some muscles coming off of that. And then down here is our inferior angle. A good reference point is to know that actually the bottom or the inferior angle of the scapula is always at vertebrae level 7 right here, T7. All right, so here we go with our muscles. Let's start. We'll start superficial. I'm sorry, deep, not superficial. This is our infraspinatus. Notice how it's on the infraspinatus fossa and comes over here to the lesser tubercle. Can't really see the greater tubercle. It's kind of on the other side over here. But that's the infraspinatus, below the spine of the scapula. Supraspinatus is right up here. And here's actually the greater tubercle. It's really more on the side, but you kind of get the idea. So that inserts on the greater tubercle, and this is lesser tubercle. These are both stabilizers, and the infraspinatus does a little bit of lateral rotation. So since we're on the posterior side, that's why it's going to cause some lateral rotation. And the supraspinatus is going to cause a little bit of adduction because look, it has a lateral attachment. All right, let's go next to the teres minor. Teres minor is up here, coming off of the scapula, and it also has the same insertion as the infraspinatus. And teres minor is going to have some lateral rotation, and it's mostly a stabilizer. And then we'll come over here to teres major. Since there's a major, there's usually a minor. Or a minor, there's a major. Now, you can't really see the insertion for teres major. Major meaning longer or bigger. It actually goes and wraps around the other side of the humerus and inserts onto the intertubercular groove. So do you think it's going to cause internal rotation this time? It's grabbing the other side of it, and it's going to pull it this way. It's going to cause medial rotation. So if you think about the position where it inserts, it makes sense. Okay, I think I'm going to go 30 more seconds, and I'll pause and make a part 2. So teres major and teres minor are what we call antagonists. They perform opposite movements. So if one causes medial rotation, the other causes lateral rotation, then we call them antagonists. And those relationships are really important because when we weightlift or when we treat patients, we don't want to just focus on the areas of weakness. So if they're weak in lateral rotation, so should we do everything? Should we work on all their lateral rotators? No, we got to work on their medial rotators. Otherwise, we're going to cause an imbalance in muscle flexibility and strength. I'm going to pause there. We'll finish the rest of this up, and then we'll talk some pathologies too.